All right, halfway through episode 4. Let's talk about ganglion cyst. All right, so ganglion cyst is really just a leaky joint. Think of it as you put motor oil or synovium in a joint so it moves and doesn't break down over time. Sometimes you get a hole in that casing and a little bit of oil leaks out, just like your car. So we're looking at it from two phases, one a traumatic one and one just happens from time to time. This is a lady that has a ganglion cyst on her foot. You can aspirate them or cut them out. First thing we're going to do is aspirate hers and see how she does. My trusty PA student, he's back there somewhere. There he is. So this lady has a ganglion cyst. Ganglion cyst is when joint fluid leaks out and it causes you to have swelling on your arm or your leg that causes pain and discomfort. So we are going to fix it. If she'd get off the phone.
Yeah, I told my daughter you talking about my ashy.
Your foot is ashy. I don't understand. It is. Did you see it?
She know that I don't keep it like this.
You do. All right, hold that for a big fella. All you do is hold it right there.
See you later.
Oh, you don't know how to use this, do you? There you go.
Right.
Just hold it right there. All right, young lady. So, how long has it been there?
Since 2023.
Okay.
Been trying to get in October. That's when I noticed.
You've been trying to do what with it?
Oh, no. Well, trying to get it seen about.
Oh, okay.
Yeah.
All right, and then now you showed up here.
Well, Dr. Bradford referred me to you.
Okay, well, somebody likes you.
Everybody likes me.
That's not
Except
true.
for you, you bring
Oh, wait, hold on. Why do you say I don't like you?
because you ain't bring no lotion.
Listen, that is true. That.
I'm gonna get you some.
Hey, let me do what I got to do first, and then we'll put some lotion on your foot. How about that?
No, it's cool.
I mean, we got to do something. I can't let you walk out of here looking like that.
It's cool.
Somebody might say I messed your foot up. Somebody might think that I did something wrong to you. Call that lotion police.
Stop. It's gonna hurt.
Won't hurt me a bit.
I'm talking about with me.
Huh?
I'm talking about with me.
No, it might hurt you a little bit. All right, so what you got to do is not look here. You have to look there. So you want that in the center. All right.
Don't give me the pain first.
This is the pain medicine right here.
What?
Why are you frowning?
Cause I don't know how it's going. You can tell me that, but it might sting a little bit.
I ain't got to that part yet. I'm just wiping your little ashy foot off, make sure it's not dirty. Look, it's not dirty. It's just ashy.
I know that.
You wash your feet. You just don't put lotion on.
No, it just that right there makes me not want to do nothing to it because it hurts.
I know. All right, so a little bit of pain.
Thank you.
Just to numb it up. And then after that, we will,
I don't know if I can call my other daughter.
hold on, what you doing?
Okay.
A little stick. You ready?
Yeah.
1, 2, 3. There you go. So we're going to put a little numbing medicine on it. So you'll see the differences if you do this. It's just lidocaine. Okay. So we're gonna get rid of that. 1, 2, 3. You shouldn't feel that.
I did though. I don't feel you jabbing now. A little
Good.
bit. Yeah, all my doctors love me. They always trying to take care of me. That's what's coming out. So what is that?
Joint fluid.
That's a lot.
It's a little bit.
It's a little bit.
You got a lot more in there, but that's. Or is it too thick?
It's too thick. Oh, let me be quiet because you trying to educate them.
No, we educated everybody. You too. Hold on. Let me get a scalpel. Hey, Sally.
Hey.
Let me have 11 blade real quick, please. So we're gonna make a little incision to get all of that out. Thank you, man. All right. A little small incision.
Where my daughter at? Put on phone. Hey, they squeezing the stuff out. I told him I had to call my other daughter. But he told me my foot. Ooh. Ooh, that's a lot.
Mm-hmm.
Let me see. That's my other daughter.
Oh, they both sit at the house with hair hats with what you call them? Bonnets on.
Yeah, they did. That's why I said, "Why you talking about my foot?" He was talking about my foot was ash.
It is ash.
See?
Shut up.
Oh, she told the truth.
Well, you know why? Cause y'all little feet be dolled up. You see it?
Hey, look at that. Can you see it?
Look at all the stuff he pulled up out of there. He's that steady.
I'm on the camera.
Well, he got some big hands like Dr. W's.
I got. listen. Why you gonna talk about your OB with big hands? That's messed up.
What the kids at?
They're out there in the car.
I could be on my way up there. Jason to get ready and go to work.
I
About an hour.
hope it don't hurt. I know you're in Atlanta. We all in Atlanta. What you cook for him today?
A bake.
Girl, stop. Oh, you see that?
Good. You see it? I like that. Play with it. Do his thing.
Nope.
Well, he's, oh, gosh. It's like a pimple.
Kind of is.
It's a cyst, ain't it?
Mm-hmm.
I told my Ty had to get off the phone with me, so.
So she said she had to call her favorite daughter.
Nah, this the headache, though.
Oh.
Jay laughing at me.
So what you're gonna have to do,
Hold up, T.
what you're gonna have to do, is get a wrap or a tight sock. And you're gonna wrap it so that it doesn't fill back up with fluid. Does that make sense?
Mm-hmm. Why did it fill it up like that anyway?
Just because the joint fluid will sometimes leak out.
Mm-hmm. Because I know I had this knee, had arthritis in that knee. So I don't know if that's a... Shut up. That's why I told him, don't look like this.
Especially that baby one.
Stop.
That's that one that cried wee all the way home.
That baby toe. That's the one that cried wee all the way home.
That thing looks rough. All right, so you can see the difference. Okay. So we're gonna get a little wrap in here, wrap it up, and then what you're gonna do is keep that wrap on there tight, so that it keeps it flat and doesn't fill up.
So do I need to put like after treatment?
Just put some bacitracin on or Neosporin or something like that.
Okay.
But this is the stuff. This is just joint fluid. See how sticky it is?
I don't want to touch it. Stop. He did squeeze it.
Just like little jelly.
That's why it was hard.
Yeah, that's why it was so tense, because it was just leaking out. All right. Do you have any questions?
Ask my daughter.
You got any questions, young lady? Huh? No. You have to take that bonnet off when you work in my office.
Oh, okay.
You can't be coming to work.
Oh, show him your hair.
Is it
Show
rough?
him your hair. No.
Is it rough underneath there?
No. Oh yeah, now it is. Some came out
Ooh,
out of place.
Ooh.
She got cute yesterday.
it wasn't cute.
Yes, it was.
You say it was cute.
Both my babies.
Let me see it. Let me see it.
Why you putting her on camera? No.
She might want to be on camera. She might be ready for it.
All right.
And what will happen is, so like I said, we're gonna wrap it up with Ace Wrap here in a little bit, and then come see me in 2 weeks, and we'll see how you do.
No pain medicine.
You don't need pain medicine for that. It didn't even hurt. A little small thing. Tylenol and Motrin. Okay?
I don't know if I can take no time.
You can. Lift your foot up for me.
Girl, he sit up here and just talked about my dog all that.
I did not talk about your ashy foot. I pointed out that your foot was ashy. Those are two different things.
Yeah.
Hold on. So she did well. Hers was a pretty interesting one because it was too thick. And I think that was because it was there for a little while. We see that sometimes, not a big deal. But it is done. We'll get her Ace Wrap on it, keep it pretty tight. Hopefully that'll fix it, and she should be good to go. All right, thank you.
Fever.
Oh,
White Plains
For real?
fever. Yeah.
Dang. Yeah.
Wow.
The rest of them he brought in on his van and called us and said, y'all come and load this van.
I love it.
so if we kill something and get it mounted, and my wife won't
Just
let me bring it in,
Just
Yeah.
bring it
Just
here.
bring-
display it. We'll display
what about
it.
that? I need to bring my deer head up here because
Bring
it's at
it
my
in. And I
daddy's in
think
the
that's how we
basement.
got most of these, or something with, I don't know if there was a divorce and then
No, I
the
think they
wife
died.
or somebody
I
died.
think they
and
died.
Then
The
the
wife
wife,
didn't
ended up didn't want the stuff. Something happened, and one of them did not want it, so he got it. Yeah.
That's cool. That's cool.
I love it. So you're neighbors with Alexis?
I am.
She is
Yeah.
precious.
We just stole her
love-
away.
We love her.
Yeah, she's
Absolutely love
yeah,
her.
she's so funny. Oh my gosh. Yeah, I stole her from Anniston, North.
And I know. Well, and I
You
think
did
she
good.
likes
You
it.
did good.
I think she likes it though. She likes the
She's perfect.
ability to, yeah, because she likes to still be able to be a mom.
Oh yeah, that's number one.
Yeah.
Yeah, that's number
So
one.
she's good. Our kids play together after school almost every day.
Oh,
So
That's
Love it.
awesome.
people.
yeah. So y'all came up in conversation, and she was like, "That's my neighbor."
Yeah.
We were like, "Oh gosh,
Yeah.
help us, help us."
So what do y'all need from us?
Well, we get a lot of your PEG 2 patients.
Or wound care.
Or
once in a
wound
while.
care.
Yeah.
So we just want to pick your brain and what procedure.
So you aspirate that joint, you see we could squeeze that jelly out. That jelly is what keeps those bones from rubbing and developing too much friction and breaking down and developing arthritis. Yeah, at the end of the day, if you want to make $1 billion, figure out how to get fluid back in that joint. If you can do that, you would be a billionaire overnight. But we haven't figured it out yet, and I haven't figured it out yet. So I'm still doing videos. Anyway, so this next patient kind of had the same thing, but they had an injury to their arm. Can't remember if they fell or they crushed it, but they know they had an injury, and then that swelling started up. So what we decided was we were going to aspirate it in the office. When we did it in the office, we got a little bit of blood out, which is different. So that means we took them to the operating room, and this is what we found. Oh yeah, I look good in these glasses. So today, it's a good look. Nice. This next guy has what I thought was a ganglion cyst, but it turned out to be an aneurysm of his wrist. So what we've got to do is go in and take that out. Aneurysm is basically a big bulge in a vessel. They can be painful and tender when they get big, so that's what's going on with him. And I got to use these which magnify so we can see what's going on. Oh man, let's see if I can show you this thing, see what it looks like.
Oh, okay. You did a divorce her.
So,
Trying to make us all jealous.
so that's it. Turn that hand for me a little bit. There you go. Other way. Perfect. You can see it bulges a little bigger when you turn it. All right, relax it. So it's smaller. So yeah, that is where we're going. I have to turn it again. Yeah. Okay. Cool. So this is it. So we're just gonna make an incision right on the top of it. If we go too deep, of course. Yep. Let's see. So we can lower this. Try not to do this on these aneurysms sometimes because you'll poke the aneurysm. Because we're trying to get all the lidocaine in. So there, so we can go across. And
You want that? 1, 2. You know what I mean.
so dissect this out.
I'll stand here. I'll protect you. Sally, this isn't bad. That's fine.
So you can see big purple thing right there. That is it. Got a Wheatlander. Doesn't matter. So put this in. But you can see how this is. There we go. So what we're going to try to do is get proximal control or distal control first. Because it's a vein, we can get proximal control. That'll save us a lot of headache. You got a little small retractor? I'll put it in there. Hold on. Don't wanna go there. Okay. There we go. So let's see. So I see it. You got a right angle? Table up just a little bit, please. Thank you, ma'am. That's good. So this is kind of weird because it's kind of branching a couple different areas.
Make sure that's not pulsatile, and it's not, which is good, so it's not an artery. Oops. Second there for me. Watch your hands. Oh, you got a silk tie? That's fine. So now we're doing this, we've gotten around one part of it. So what we're gonna do is tie it up. Let me actually have two. Try something weird. Oh, here's the other one, I'm sorry. I didn't see it. Is that the one?
Yeah.
Oh, that's right, y'all use those super long ones here. So Sally, grab out one. Right, pull one of yours. Just separate, pull it, grab it. So whose is whose?
Mine.
So you take that one. This one's mine. So we just ligate it here. Yeah, we will. So I'm just ligating this one. And ligate this one as well. So what you want to do is you should pull it up, hold it over. So what you can see here is that we have a little small space between the two. And all we do is keep doing that. And you can see it looks like it's starting to go down, but now I've gotten some control. So we can start being a little more aggressive with it and getting into it a little better. As my cameraman continues to back up each time.
Trust issue.
It is.
It's trust issue. It's okay.
It's reasonable.
Look, I stand in front of him every now and then.
So here's the cool part, is the dude also has a ganglion cyst in the midst of all of this. So some of this is ganglion cyst, some of this is aneurysm. So we just kind of gotta dissect through and figure out which part is which. You know, last little bit. So yeah, that's fine. So now that I have it controlled approximately, I don't worry about it as much. And you can see, thank you, starting to define it a little better. Right angle, please. Get in there. I'm gonna have 2 silks, please.
Watching what y'all doing, I drifted off.
Got sleepy.
No, I was like looking around, I looked up, I was in the center of it.
Oh yeah, dude, I do that sometimes when I'm filming stuff. I forget to. You start watching the procedure and not watch the camera.
Yeah.
So some of this you can't see in the video, some of it you can. Essentially, there's a vein that ruptured into a ganglion cyst.
Which
We
one
don't
you got?
know
That's
if the
yours?
ganglion cyst was there
This
first
is
and then the
mine.
vein ruptured into it, or the reverse, or there was trauma that caused an
So
aneurysm
ligate
and
here.
the ganglion cyst. So either way, we had the ligate, the vein on both sides, and then make sure right before you ligate a vein, you got to make sure that patient has a pulse. He does.
Hold it. Good. I think this occurred because of some traumatic injury or something. Yep. So we tried that, didn't work. So as weird as it sounds, you would think that what I would do is now just take this out, cut it. Yeah, you got a knife, please? So what we're gonna do is poke a little small hole in it. Get that suction ready, please. Just a little small hole. There we go. So old clot's coming out. So that's all old hematoma, which is good, which means we're not bleeding, which means now we did everything that we were supposed to. So now we actually can get into it pretty rough. What it also tells me is that I have ligated what I needed to ligate, and instead of cutting it right there, I'll cut it on that side, dissect it off. Hemostat, please. Actually, I can use this. Where's that bleeding coming from? Yeah, back on something. Oh yeah, I see it. You got any of those small vessel clips?
Small clipper pliers?
Yeah, small clipper plier. So back to our regularly scheduled program. So what we're seeing here is actually pretty cool. I'll get another one in a second. So what's happened is you can see here's his ganglion cyst. So he actually had 2 problems. He had a ganglion cyst, and he also had this aneurysm that probably resulted from a fall. So that's why it was getting bigger and smaller, was because of the aneurysm. But it was, when we tried to aspirate it, we got a lot of blood because of the aneurysm. So, 2 operations in one go. Works. Oops. You don't like when your surgeon says oops. I'll set it. reason I'm not using cautery and I'm okay with bleeding is what I also want to make sure is I don't injure any nerves or anything unless absolutely necessary. So, oops, and there's that's the ganglion cyst.
So now you can see us taking out the ganglion cyst and the piece of it. Again, it doesn't have a true cystic wall, so you kind of have to be in between removing the fluid, scarring it down without necessarily scarring in the joint and increasing the risk of arthritis. Not so much in old people, but in young people, especially with sports injuries, you're seeing a lot more.
I'm supposed to put a clip on both sides, but we're kind of actually get this out of the way. So that's it. That's from the ganglion cyst, the clear stuff, and the other part is the aneurysm. Cool. All right, now let's get a clip. There's it. See this? Cautery for a sec. The fact that it's not jumping is good, means we're not close. Oh, there he is. That's it. You go deeper than this, you're going to get into the, which end is radiating ulnar artery, the supply, bottom. But we are not going to the bottom. So there is no more bleeding, so all with these scissors, got them. Cut that off, cut that off, cut that off. And the most important thing is got to make sure that my man has a pulse. He does there. And he does there. So yeah, we're just gonna close that up. And that's it. Loophole. So yeah, so now we got it closed up, and it looks a heck of a lot better than it did before. And after we kind of looked at it a little further, it looks like he may have been ruptured his radial artery, and that's what all of this was about. We did an Allen test, as our PA reminded us, where you clamp one side and see if you still have flow and all this capillary refill, and he does. So he has the same flow that he did before, but that explains the aneurysm, that explains the ganglion cyst, all in one diagnosis. So it's probably a radial artery aneurysm that traumatically occurred when he fell. I can't remember what he said he was doing when he fell. And then we put benzoin, not benzoin, that's actually Dermabond, bootleg Dermabond, not the good stuff. And stair strips over it. And that's it. Oh man. 1, 2, 3. All right, thank y'all. Appreciate it. Bye. So that's how you excise an aneurysm. So more than likely, it was probably a radial artery aneurysm. You have a radial and an ulnar artery. The radial usually is the main supply. Oh, appreciate it, brother. Radial is usually the main supply. Ulnar is the backup. But in him, it was kind of cool when you pressed on the ulnar artery, you wouldn't get pulse at that pedicle that we ligated. Typically, when you're doing vascular surgery, you clamp, cut in the middle. With these aneurysms, I've learned that you actually tie, and then just cut the aneurysm out. You do that because if it slips off one side or the other, you're in a world of hurt. So being able to do it twice on both sides is better security long term. But that's it. So the clear stuff, that was from the ganglion cyst underneath it, and black stuff, that was old clot from probably where he just ruptured that radial artery and developed an aneurysm. That's surgery. Sometimes you know, sometimes you don't. Either way, you gotta know how to fix it. All right, thanks. All right, so now you know how to deal with a ganglion cyst. You can aspirate it. It's also called a Bible cyst. So there's this whole story that if you hit it with a Bible, it will rupture and won't come back. That's actually true. It doesn't have to be a Bible. My dad had one on his wrist and he got kicked by a cow and it went down. But I remember him all my life having that big ganglion cyst on his arm. But yeah, you can traumatically hit it and it goes away. You can aspirate it, comes back 50% of the time. Or you can take somebody to the operating room and remove it and it stays gone about 85% of the time. All right, halfway through. Let's get it to season 5. Thanks for tuning in. Take care.